Hello everyone, I'm Jon Salmanton-García from the University Hospital of Cologne, and today I will present our results on the current state of laboratory mycology in Asia, diagnostic and treatment capacity. These are my disclosures, and just as a bit of background, invasive fungal infections are a major threat for different types of patients. For example, those with HIV, also patients admitted in ICU, patients with malignancies, also patients after natural disasters, or there might even be invasive fungal infection outbreaks in Asia and the Pacific. Also quite relevant in this region, the uncontrolled diabetes mellitus, and last but not least, viral infection after influenza or SARS-CoV-2, for example. Our main objective in this case was to decipher the current diagnostic capacity and the availability of the different treatment options for invasive fungal infections in order to guide health professionals, patients, and policymakers. We did this with an online survey, which could be accessible via the link you can see in your screen or the QR code. We contacted all the researchers we work regularly with, also all the members of the European Confederation for Medical Mycology and the members from the International Society of Human and Animal Mycology. Afterwards, we looked in different online search engines like Google Scholar, PubMed, ScienceDirect, or clinicaltrials.gov. And then we provided and we advertised the link to the survey in our social media, both in LinkedIn and in Twitter. All this research topic was started in 2019 in Latin America and the Caribbean. It was expanded to Africa, to Eastern and Southeastern Europe, to the whole Europe, and now Asia and the Pacific, where we collected information from 235 sites from 40 countries. We divided our survey in 3 different topics. The first one, the incidence. And first, we asked our participants about the incidence perception of invasive fungal infections in their institutions. In the countries with a GDP below $3,000 and the countries with a GDP between $3,000 and $20,000 US, most of the sites considered that the incidence was either very low or low. However, if we were focusing in countries with a GDP over $20,000, we could see how the perception of incidence was getting increased. Asking about the most frequent pathogens, in any case, Candida was the most frequent one, or considered as the most frequent one, and Aspergillus the second one. But we could see differences in the third one, Mucorales in the countries with a GDP below $3,000 and Cryptococcus in the rest of them. As for diagnostics, the second section in our survey, regarding microscopy, we could see that this was available almost in all the analyzed institutions. And it was possible, or it was actually always used at least in the 50% of them. Regarding culture and fungal identification, the techniques for performing such a diagnostic was available in almost all the institutions again, and the species identification, it was possible in more than 80% in any case. For serology, we could see how there was access to at least one of them in the 90% of the institutions from the countries with a GDP over $20,000 US. But if we look for the countries with a lower GDP, we could observe how this number was between 50 and 60%. For the antigen detection kits, again, in the countries with a GDP over $20,000 US, the access was around 95%, and in the countries with lower GDPs, it was between 75 to 80%. And last but not least, molecular tests, they were available in a bit more than 80% of the sites from countries with a GDP over $20,000 US. in 70% of the sites from countries with a GDP between 3 and 20,000 US dollars, and in the 50% of the sites with or from a country with a GDP below 3,000 US dollars. And the last section of our study or our survey was the access to antifungal drugs. We could see first regarding amphotericin B, how the access was in the 80% in the countries with the highest GDP, the access actually to liposomal amphotericin B, around 70% in the countries with the lowest GDP, and it was the access to liposomal amphotericin B was a bit below 40% in the countries with 3 to 20,000 US dollars of GDP. For flucytosine, we could see how the access rate was lower as compared to liposomal amphotericin B, and there was a gradient according to or directly correlated to the GDP of the country. And similar thing was occurring with terbinafine. That way we could observe 80% of access in countries with a GDP over 20,000 US dollars, almost 50% in the countries with a GDP between 3,000 and 20,000 US dollars, and 50% in countries with a GDP below 3,000 US dollars. For echinocandins, the most commonly, for the echinocandins, we had at least one accessible in 90% of the countries with the highest GDP, and then the levels were similar for the rest of the countries, around 70%. In any case, the most commonly available one was caspofungin. And for triazoles, there was at least one triazole available in 90% of the countries in any case. But if we look for mold-active voriconazole, the access was a bit different. We could see how the levels for voriconazole were close to 80% in the countries with GDP below 3,000 US dollars, in 70% for the countries with 3 to 20,000 US dollars, and around 90% in the countries with the highest GDP. Afterwards, the second most common one was itraconazole, except in the case of the countries with GDP between 3,000 and 20,000 US dollars, where it was the most common one. And if we focus now on the latest triazoles, isavuconazole and posaconazole, we could see that in every geographical setting, posaconazole was more frequently available than isavuconazole, and actually that the area or the sites where isavuconazole was more frequently available didn't really reach the 40%. And finally, regarding therapeutic drug monitoring, we could see how this was accessible at least to one drug in the 50% of the sites, and it was getting increased depending on the GDP of the country. And in any case, the therapeutic drug monitoring for voriconazole was the most frequent one. With this, we can draw the following conclusions. The first one is that it's urgent, there is an urgent need to improve the laboratory capacities in Asia and the Pacific. The second one is that there is a worrisome low number of antifungal availability in certain countries of this region. Then there is an heterogeneous access to diagnostic and treatment tools, that substantial differences based on macroeconomical situation of the country are existing in Asia and the Pacific, and therefore inter and intra-regional collaboration is necessary. And we have to keep in mind that Asia and the Pacific is a region with endemic invasive fungal infections. Further results on this topic are available in the International Journal of Antimicrobial Drugs. Thank you very much, and see you next time.